Our kidneys are vital organs that play a huge role in filtering waste from our blood, balancing fluids, and regulating blood pressure. So, let's talk about why it's crucial to keep an eye on them and what signs might indicate something's off. Changes in urination patterns. The first warning sign that your kidneys might be failing is a change in your urination patterns. Since your kidneys are responsible for producing urine, changes in urination can be one of the earliest signs of kidney problems. You may notice increased frequency of urination, especially at night, known as nocturia. Alternatively, you may experience a decrease in urine output or difficulty urinating. You might also notice that your urine appears foamy or bubbly, which can indicate the presence of excess protein, a condition known as proteinuria. Swelling in the legs, ankles, and feet. The second warning sign is swelling, particularly in the legs, ankles, and feet. When the kidneys are not functioning properly, they can't remove excess fluid and sodium from the body. This leads to fluid retention, causing swelling, especially in the lower extremities like the legs, ankles, and feet. This condition is known as edema. Edema can make your skin look shiny and tight, and pressing on the affected area may leave a dent. If you notice unexplained swelling, especially if it gets worse over time, it could be a sign that your kidneys are struggling to maintain fluid balance. Again, this is a sign you shouldn't ignore. It's important to consult a healthcare professional to determine the underlying cause and receive proper treatment. Fatigue and weakness. Moving on to the third warning sign, fatigue and weakness. Healthy kidneys produce a hormone called erythropoietin, which helps create red blood cells that carry oxygen throughout the body. When the kidneys are damaged, they produce less erythropoietin, leading to a decrease in red blood cells and, consequently, a condition known as anemia. Anemia can cause persistent fatigue, weakness, and a general feeling of tiredness. You may find it difficult to complete daily tasks, feel short of breath, or experience dizziness. If you're feeling unusually tired or weak and it's not due to a lack of sleep or other obvious causes, it could be a sign that your kidneys are failing. Shortness of breath. The fourth warning sign to watch out for is shortness of breath. Shortness of breath can occur for several reasons related to kidney failure. First, if the kidneys aren't filtering waste properly, fluid can build up in the lungs, making it hard to breathe. This condition is known as pulmonary edema. Persistent itching and dry skin. The fifth warning sign is persistent itching and dry skin. Healthy kidneys help maintain the balance of minerals and nutrients in your blood. When your kidneys are failing, they may not be able to maintain the right balance, leading to a buildup of waste products in the blood. This can cause persistent itching and dry skin, a condition known as uremic pruritus. Itching caused by kidney failure tends to be more severe and persistent than typical dry skin or seasonal allergies. Metallic taste in mouth and ammonia breath. The sixth warning sign to look out for is a metallic taste in your mouth and ammonia-like breath. When the kidneys fail to filter waste effectively, toxins and waste products build up in the body, including in the blood. This can cause a metallic taste in the mouth, making food taste different or even unpleasant. Some people also report having breath that smells like ammonia, a condition known as uremic fetor. This happens because the breakdown of urea in the saliva releases ammonia, leading to a distinct, unpleasant odor. Nausea and vomiting. Another warning sign is nausea and vomiting. An accumulation of toxins in the blood due to failing kidneys can cause nausea and vomiting. This is because the body is trying to get rid of the waste products that the kidneys can no longer filter out. Persistent nausea and vomiting can also lead to a loss of appetite, weight loss, and malnutrition, which further complicates the health issues caused by kidney failure. High blood pressure. The eighth warning sign is high blood pressure. The kidneys help regulate blood pressure by controlling the amount of sodium in the blood and producing a hormone called renin. When the kidneys are damaged, they can't regulate blood pressure effectively, leading to hypertension or high blood pressure. High blood pressure can further damage the kidneys, creating a vicious cycle that can lead to kidney failure if not managed properly. If you have high blood pressure, it's important to work with your healthcare provider to manage it effectively and protect your kidneys from further damage. Pain in the back or side. Last but not least, the ninth warning sign is a pain in the back or side. Kidney pain is often felt in the back or side, typically below the rib cage and near where the kidneys are located. This pain can be sharp or dull and may come and go. It's often mistaken for back pain but is usually deeper and more intense. If you're experiencing persistent pain in your back or side that doesn't seem to be related to muscle strain or injury, it could be a sign of kidney stones, infection, or other kidney issues. It's important to get any unusual pain checked out to rule out kidney problems and receive appropriate treatment. So, what do you think? Have you or someone you know experienced any of these signs? Drop your thoughts in the comments below.